My story is that I'm a scientist and a drug development professional, but I'm also a parent that one day heard the most terrifying words any parents may hear: your child has cancer. It was really frustrating for me. Of course, as a parent, you receive a cancer diagnosis for your child, but as a drug development professional, it was very difficult for me to accept that no drugs were available to treat my child. This is a time when I faced for the first time the harsh reality of childhood cancer. Every year, up to 6,000 children and adolescents die of cancer in Europe alone, which makes cancer the major cause of death by disease for our children. Pharma industry develops many drugs for adult cancer, but the problem is that childhood cancers are different diseases, and all these drug development tend to be disease-focused. So you have pharma companies developing drugs for adult conditions like lung cancer, breast cancer, which clearly do not occur in children. But the same drugs could be very well effective for childhood cancer because the mechanism of action is similar. Well, drug development is very costly and very risky, and it costs just as much developing a drug for children as it does for adults. But because there are not enough patients, there's no sufficient number of patients, it's not really profitable for pharmaceutical industry to develop drugs for children. And this is what the problem is. When my daughter died of cancer, roughly a year after diagnosis, that was the time when I decided that something had to be done. And I wanted to do something to address the major problem for children with cancer. That is the lack of drug development, the lack of specific medicines developed for them. Therefore, I decided to set up aPODD. There are many types of childhood cancer. Some are treatable, some are more treatable than others. For example, medulloblastoma is a form of very aggressive brain cancer for which we have really very limited treatment options. Children with medulloblastoma are currently treated with radiotherapy or older drugs that were probably approved 40, 50 years ago. And these drugs tend to be very toxic. Radiotherapy as well. So even in the case when they are effective and the children are cured, cure comes with a heavy price to pay in terms of severe side effects later in life. We have identified a number of drugs that may be effective against medulloblastoma, and we are now in a position to test these in the lab. That's exactly why we need to raise now £40,000 to cover the cost of this testing. So therefore, we have the potential to have an impact on patient lives within probably 2-3 years. So that's why it would be very important to support us in this campaign. This project means a lot to me. Clearly, this is the first drug development project for aPODD. Clearly, it's too late to save my daughter, but we want to do something for other parents, other children. We want to save tomorrow's sick children. Therefore, it will be really important to support us in this project, because if we are successful in finding a potential new treatment for medulloblastoma, we could potentially apply the same process, the same method, and try to tackle many other childhood cancer.